Hello everyone. September is dedicated as a month to create awareness about PCOS. So we are going to come up with a series of videos that address this problem of PCOD or PCOS to help all the women understand this disorder in a much easier way. So what exactly is PCOS? PCOS or polycystic ovarian syndrome is a hormonal disorder that affects women in their fertile or reproductive years. 1 in every 5 Indian women are known to suffer from this disorder. So what exactly happens in PCOS? Sometimes our ovaries develop a small collection of follicles that inhibit the ovaries from releasing an egg regularly. This might lead to delayed menses, sometimes prolonged menses, or even an excessive production of male hormones in a female body. All of us know about PCOS, but very few of us are aware that there are various types of PCOS. I'll take a minute to talk about the various types of PCOS now. The first is insulin resistant PCOS, second is inflammatory PCOS, the third one is adrenal PCOS, and the fourth one is a post-pill PCOS. Insulin resistant PCOS is the most common form of PCOS and it affects almost 70% of the girls affected by PCOS. It is marked by sugar cravings, excessive weight gain and darkening of skin at the base of your neck, armpits or thighs. Inflammatory PCOS is marked by chronic inflammation and problems such as acne, skin rashes, gut issues and joint pain. The third is the adrenal PCOS. In this type of PCOS, a hormone called DHEA, which is produced by the adrenal gland, is produced in excess. Also, it might have an impact on LH or the luteinizing hormone that creates havoc with our regular menstrual cycle. The post-pill PCOS is found in women who take oral contraceptive pills and then discontinue the usage of these pills after a little while. This is a relatively short-lived PCOS out of the 4 types. Let's now look at what are the causes for PCOS. The first and the most important is having a history of PCOS in your family. So if you have some immediate female relatives such as your mother, your sister or your aunt suffering from PCOS, you are at an increased risk of developing the same. The second is insulin resistance, which may be because of excessive percentage of body fat or lack of physical activity or a very poor diet. Insulin will have an impact on the level of androgens in the body, which increase the level of testosterone in the female body and is one of the reasons responsible for PCOS. The third includes your lifestyle. Now lifestyle includes 4 factors. Number 1 is your food habits. So if your food consumption has a lot of refined flour products such as regular consumption of bread or biscuits or processed food or junk food, excessive sweet consumption or excessive consumption of foods that are salty, you are putting yourself at a risk of developing PCOS. The second one is your physical activity. All of us know that physical activity has an impact on weight, and less physical activity is associated with obesity, and obesity is one of the prime reasons for developing PCOS. The third one is your stress. Stress releases a hormone called cortisol, which has an impact on insulin sensitivity and also inflammation. All of these combine to propel you to develop a PCOS in the future. The last but not the least is sleep. Yes, what time you sleep and how much you sleep is also important to keep PCOS away. Sleep is the time when your body will slow down and try and go back and maintain the hormonal balance or restore the hormonal balance. So if you have a habit of sleeping very late for years together or sleeping for very few hours of the day, you are putting yourself at the risk of developing PCOS. Let us now see what are the symptoms that we need to look out for to understand if we are at any kind of a risk to develop PCOS. Number 1 includes irregular periods or no periods or no menses at all. Number 2 is excessive facial acne. Number 3 is hirsutism, which is excessive facial hair. Number 4 is a pattern of baldness which is similar to men, which is found in females. Fifth is a dark black patch at the base of your neck, armpits or thighs. Sixth is difficulty in conceiving. Seventh is sudden weight gain. The eighth and the ninth one include stress, anxiety, depression, and last is identification of a cyst when you undergo a regular sonography. Let us now look at the risks that are associated with PCOS. The first one is putting yourself at the risk of developing type 2 diabetes or type 2 diabetes mellitus. The second risk factor is putting yourself at the risk of developing hyperlipidemia or dyslipidemia, which is increased levels of triglycerides and cholesterol in your blood, which will put you at a risk of developing cardiovascular diseases in the near future. And the third one is a risk of developing the cancer of your uterus, of your endometrium and breast. I hope this video was informative and useful. Let's all of us join hands to create more awareness about PCOS. If you like the video, please share it with your near and dear ones. In the next video, we will also be addressing how to manage PCOS by modifying the food that you eat or your diet and changing your lifestyle to manage PCOS better. So stay tuned.